Well, Connecticut Children's here in Hartford has said they're seeing a busier emergency room than usual. The Children's Hospital in New Haven is overwhelmed with young patients. While doctors are, of course, concerned with this uptick in RSV cases, some doctors are actually urging parents to take precautions ahead of Halloween and the upcoming holidays. RSV is a respiratory virus that causes cold-like symptoms in children and adults. Now, in younger children, it can cause more severe symptoms like cough, high fevers, and breathing difficulties. RSV is common in kids before age 2. In fact, all kids before age 2 are expected to get RSV. Older kids can usually fight it off, but it may be tougher on the little ones. But now there are more cases seen earlier than in past years. Severe infections can lead to bronchitis and pneumonia. Now, Connecticut doctors and doctors around the country are seeing this increase in cases, mostly attributed to kids being back together in groups after the pandemic. Dr. Hussein from St. Francis Hospital says not only are young children most at risk, but the elderly as well.
Children under the age of 5 are at risk of developing more, severe manifestations. Not all of them, though. A majority will not. And then those that are above the age of 65, immunocompromised, transplant recipients, on cancer therapy, on immunosuppressant medication. People who have multiple underlying medical problems are higher risk for developing complications from RSV.
Now, with the uptick in cases, some doctors around the country are urging parents to be careful ahead of trick-or-treating and the upcoming holidays to keep kids safe. This as the CDC is reporting a 9.6 positivity rate for RSV over the last few weeks. As for Halloween, luckily trick-or-treating is outside, so the message from Dr. Hussein is really simple. If your child does not feel well, do not let them trick-or-treat, and to make sure that your children are up to date on all of their vaccines as well. In Hartford, Lindsay Kane, Fact 61 News.